Hey, it's Dr. Centeno. I'm here with Dr. Gordon. We ended up pushing this back an hour, so I apologize for the time confusion. Ultimately, what I really wanted to do tonight was to talk to Dr. Gordon about the intersection between craniocervical instability, chronic inflammation, and infectious disease. And this is an area that I don't know a lot about, but I've talked to Dr. Gordon about this informally, and I thought it would be really interesting for patients to see in this kind of format. So, Eric, thank you so much for joining us tonight here and answering questions and talking about all of this stuff. Tell everyone about your background. How did you get started in what it is you do?
Well, first of all, thank you, Chris, for having me on. I really appreciate it. And I apologize for the sun in my eyes. I said this is in the middle, like the end of my day, and usually I'm home where there's a studio, but we're in the office. But anyway, how I got into this, this world of chronic illness, is just simply I was always interested in health. Interestingly enough, in how to keep people healthy. And you quickly learn in medical school that you have no idea really how to do that. That's just not what we're taught. But I always, and in combining with, so it was always a curiosity about what was going on in the body. And I always believed my patients. One of the problems that I tell everybody really is that the problem with doctors is that they start off with amazing open hearts, and almost everybody who goes into this does they really want to help another human being. And then they go through training, and in a lot of our training, at least in that year of internship or in the last 2 years in medical school, you spend a lot of time in emergency rooms where you are taught, instead of having an open heart, well, maybe an open heart, but no longer an open mind. It now becomes like, are you telling me the truth? Is this really what's happening? You get into that detective mode because of the nature of our healthcare system, where people who are in need of excuses or services or things, but not always, there is some mistruths and obfuscations of the truth in order to get something they need. But that's not who comes to see you in your offices. The people who come to your office are people who are just looking for help. And so listening to the patient, believing the patient, and if you're doing medicine, you're confronted by people who, after they tell you their stories, you don't have any quick answers for. Because when people with chronic illness, they have complaints that don't fit into what we have been taught to look for. You come in and you have, POTS, postural orthostatic tachycardia syndrome. Well, but if you walk into the average practitioner who doesn't see that, his first thing is, oh my God, you either have terrible heart disease or you're lying or you're exaggerating, one or the other. And because if your heart's racing 130, you should be really sick or just anxious.
Right.
So anyway, so it's all these things. So that's got me into this field, is just listening to people and realizing that I didn't have the answers from what I was taught. So then you have to keep learning and reading people who didn't fit in the mainstream. And I spent, a lot of time in the 80s learning from, learning from people like Jeff Bland, who nobody was really listening to quite yet in the 80s. And a lot of people who called themselves, there was an alternative health movement in those days. And those were the people who are now probably doing functional medicine. But in those days, we were just out there doing our best to try to help people using more natural means than we could, because most medicine is Band-Aid medicine, which is great medicine. I mean, but it doesn't fix underlying problems. But it keeps us alive, and it's not to be laughed at. It also lets you, I use a ton of Band-Aid medicine because it lets me stabilize somebody, so then their bodies can respond and can heal. Because if your body feels like it's dying, it's really hard for it to reach a point where you can really heal, because fear doesn't it's very hard to heal when you're in a lot of fear. I mean, people do. Luckily, the body is an amazing thing. People heal under all kinds of odd conditions, but you do heal easier, and if you can actually get a little sense of relaxation and less pain into the system. So, for a long story, that's how I got into this, and just listening to patients, believing them, and keep talking to people who had good ideas, because this field is full of brilliant people. I mean, just like, the work that you do is a very good example. There you were, you saw people who did not fit the mold of doing the kind of surgery and kind of repair work that everybody else in your field does. But you thought about it.
Yeah, and I love the listening part, because I remember telling our fellows through the years, if the patient doesn't get better, it's your fault. And then say, well, okay, what comes after that? Well, it's still your fault. What comes after that? It's still your fault. And then, maybe like the fourth time around, you can say, well, maybe it's the patient. But if you don't do that, then you never get responsible for your outcomes, and you never get really good at what it is you do. Because all too often, as you talked about, the medical care system blames the patient.
Yeah. Oh, yeah. And you had me there for a minute when you kept coming back with it's your fault, and I realized, but that is the point, is that when people aren't getting better, is what are we missing? What aren't we seeing? How should we look at this better? And that's a very, very good point. Strongly made.
Yeah. So tell me, in a given day, you're in clinic today, describe an average patient that walks in, and, what they have, what kind of testing you're doing, what are the things you're suspecting, how does all that work?
Well, at this point in my career, and actually for most of the people who come to our clinic, you know, they are people who have, some inability to function normally that hasn't been solved for usually a few years. I mean, because actually, when people call to make a new appointment, if you haven't failed other places, we're a waste of money to start with. I always tell people, I mean, to be fair, is that most people, there's a ton of really good functional medicine doctors out there, naturopaths, MDs, DOs, that are usually able to help people who have just been, tired, tired, stressed, chronic gut problems, early Lyme disease, early bugs. What we see are the people who've been around the block, and it's not because we're smarter than other people. It's just because we've done this longer, and we know that there are different answers for different people. Like it's, if you really believe that following the Sears protocol, that chronic inflammatory response syndrome protocol is going to help you, then you don't need me. You can do that with any good, naturopath, MD, DO, any good practitioner can lead you down that pathway quite well. The people we see are that stuff doesn't work for, because there are multiple things happening at the same time. Okay, so our patients tend to be people who, it's that positive review of systems. I mean, that's the other thing that gets doctors to stop listening to you. When just before surgeries in the old days, the intern would walk in and say, do you have any problems with your eyes, ears, nose, and throat? Do you have any problem? Do you cough? Do you have any chest pain? Do you have any problems with your bowels? Do you have any problems with your bladder? And this is the review of systems, and like in 5 minutes they've asked your whole medical history, because they didn't care. But our patients have positive responses to generally 5 to 10 of those questions. And because it's all interactive and it all, so I'm not really answering your question. I'm just saying the patients we see tend to be complex, but in their own ways. Now, do all of them have, tick-borne disease or no? A lot of them do, because unrecognized tick-borne disease, unrecognized chronic viral disease is part of what keeps the immune system overly active, or like what leads to long COVID? I mean, these days we see a lot of long COVID patients, but again, it's the same story, is that the COVID or the vaccine isn't usually what isn't the only reason you're sick. It might have been the final common, or the last known event, but billions of people, literally billions of people, have had COVID, and billions of people had a COVID vaccine, and most of them seem to be okay. So there's something different about you that allowed that to happen, and that's what we dive into. What is it about you? And there's always the genetics, which we look at, but the more important things for most people are their environmental exposures and their past infections and how your body has dealt with them. Some infections your body clears completely, but many infections are not cleared completely, and they're dormant as long as your immune system surveillance is working well. But a big stress, or things like COVID, because of the way the really, I don't call them nefarious, but the difficult ways that COVID, through either viral persistence, vaccine persistence, or just how it caused persistent inflammation. There's so many different ways that COVID has interacted with the body that has allowed dormant infections to begin to get reactivated. Okay.
And let's follow that thread for a second. So dormant infections, tell me about what's going on there, what happens there. It sounds like your thought is that dormant infections can trigger that immune surveillance and cause chronic inflammation. So go down that thread a little bit.
Okay. Well, basically, in order for an infection to persist in your body, it has to come to some terms with your immune system. The immune system, our microbiome lives with our immune system. And when the bugs get out of the gut, like I said, the tick-borne infections, figure Epstein-Barr, which lives in our B cells, or HH6 and HH7, other herpes virus, they live in our T cells. So these guys have evolved with us. I mean, literally, probably, like the viruses, probably over 1 billion years, God knows, for as long as we've been evolving as a species. No, we haven't been around that long, but mammal, put it like mammals, right. and these bugs, we've co-evolved. Okay, they turn on our immune system, and our immune system responds to them. It's a dance now. So, and Lyme, I think Lyme is a good clean example of this, because I said, God knows how many people have Lyme disease and don't know it. We all walk around in the wood, people hike, they get tick bites. You don't know you get a tick bite half the times, at least, because the ticks anesthetize the skin, and they tend to go in places that you don't look. And they eat, they feed, and they fall off. And so you didn't know you had it. And you might get a cold, and you might get nothing. But that was Lyme disease. And if you're really good, your immune system maybe knocks it out completely. And if not, it takes up residence deep in connective tissue, often, where the immune system surveillance isn't that good. But it also releases cytokines of its own, and also stimulates your own body to release cytokines. Like one of the famous ones is IL-10, which we see a lot, which is something that your body releases to kind of quiet down to prevent an over-aggressive T cell response, so you're not busy killing too many of your own cells that might be a little sick. And so your body develops a new homeostasis of, like, your cytokines have a different balance now. So you're not going after that Lyme but again, the Lyme is staying quiet. So that's how we live with these bugs. And that's all fine until that trade-off that you made in order to live with Lyme, and then suddenly you get another infection or a big stress, and your immune system is called to work really hard, and the Lyme has interfered with your body's able to give a totally good response, and then the system starts to unravel. I mean, it's each bug has a different way of interacting with your immune system for its own survival. Okay, and so that's why there's no easy things, and there's research on all of this stuff. It's not put together because these bugs generally don't kill you. And when they do kill you, they kill you because they're overwhelming. And then we're back to regular infectious disease, which is based on what is going to kill you or disable you. And so that's why these bugs have stayed quiet, because doctors decided, I don't know when, about 40, 50 years ago, that other than tuberculosis and leprosy, there weren't too many bugs that lived in your. That was a very. So that's why the problem of being in the office, not in the studio.
No worries.
But other than TB and leprosy and maybe Q fever, that infections were either short-lived or you died. You know what I mean? Like the chronic infections, were rare. Something like osteomyelitis or infection in the bone that could stay. But the idea that these other bugs lived with us, we just said, that's not true. They all go away. The body's sterile. And this was a belief system. But in medicine, belief lives very strong, because we're I always tell people we're a little bit scientists and a lot kind of like more we're healers, and the scientist often gets crowded out by like this is what my teacher taught me.
Yeah. Well, I like your statement there. The body is sterile because a great example of that from what we do is that we were taught that the discs were sterile, right? And you could give someone a disc infection, let's say surgery or an injection, but then they found out the disc had microbiomes. So the body isn't sterile. We've got bacteria and bugs all over the place, including in places we had assumed we didn't have them. And that seems to be, that was only discovered about 6 or 7 years ago, that the disc had a microbiome. So that's an interesting one.
Right. If you had said that 10 years ago at one of your orthopedic meetings, they would have crucified you.
Yeah.
I mean, that's how strongly doctors believe in the stories that we were taught in medical school, and then we have to spend the rest of our career unlearning them, because as every the apocryphal story that they always tell the first day of medical school is not all of them, but many medical schools, the professor will say, half of what we're going to teach you is wrong, and we don't know which half it is, because they're honest in the beginning, and then then they forget that teaching, and you go out in the world and you think whatever I know is absolutely right, and then you keep being confronted by these strongly held belief systems that don't let you see what's in front of your face. Which is the idea that infections are, in a lot of situations, are chronic and lifetime, and sometimes they have to be addressed, and sometimes the patient seems to do okay, and it's so that comes back to, you got to listen to the individual in front of you and see who they are, and not try to treat them as though they're a population statistic.
Yep. So you see, I love this idea of multiple insults, right? Also that the body can have bugs living within it. We certainly know that now through all of the research published on the microbiome, that we live with bugs, that we get used to living with bugs. Certainly would make sense that some of those living arrangements would lead to chronic inflammation. And then how do you think that interfaces with CCI, since we have a lot of CCI patients on here? What's been your experience with all of that?
Well, I'd say just I call out to the unfortunate folks with CCI, or just all the people who are a little hypermobile, and look at their own histories. Our experience has been often when we talk to patients, many of them were athletes and were really physically strong and robust and doing whatever they wanted to do, the 20s and 30s, even. Usually they started to get into trouble after they got sick. I don't know, because you see a lot more CCI patients, but the ones that we see all,
yeah.
the CCI always has developed in the context of chronic inflammation. Like the point when it became symptomatic. Okay, because they've always been lax, and maybe there was that little head bump, or sitting in the dental chair, or like a car accident or something. Or, doesn't need to be a big one, just a short stop. That maybe the symptoms came on strong, but usually in those years just before that, there was they started to develop more irritable bowels. We often see that, like, bowel symptoms were a problem for the 4 or 5 years before the CCI started to make noise. Again, the regular one. You've seen one of my the patient who taught me about CCI by appearing with severe CCI had dengue. But he had chronic dengue, which can happen. Dengue can sometimes, and he had that chronic inflammation. He had other bugs underneath, but it was, until then, he had been a rock climber. So obviously his neck was in pretty good shape. He was muscular as hell, but it was that what was almost a year of low grade inflammation. Okay, because what inflammation is, well, God knows what inflammation really. It's when in order for your white blood cells to get out of the bloodstream into the tissue, okay, and what happens when you get inflamed or you have an infection, you release a lot of different chemicals, like these metalloproteinases, but just lots of a lot of the cytokines that we talk about, the interleukins and interferons, will all TNF alpha, they all have a tendency to make the connective tissue between cell to cell a little more open, a little lax, make a little more space. So bigger to white blood cells that are normally too big can fit through. Well, when this keeps happening, when those same chemicals keep happening, and you have connective tissue, which is a little different to begin with, it gets a little more lax. And that's all you need to go from having no symptoms to having symptoms. And we see it because sometimes, we've had a few cases where people have had, significant symptoms from CCI usually, or, one of these cervical vertebrae. And when the infection's been cleared, things tighten up again. Because you can feel it. Again, I don't need an X-ray. Just somebody with good hands, you can feel the tension, and you can feel the fact that now you can't pull that neck up. It's like a normal neck. You pull it and, there's a little laxity, but basically everything is sitting together rather than the head moving. And just the fact that the symptoms go away. People no longer notice when you press down on their, because, it's hard for people with CCI to realize that, if things are working well, you can carry 50 pounds on your head, or you can have it pulled up with 50 pounds, and it doesn't change your neurology. You know, you don't think better or get a headache.
So what would that
So,
treatment look like? So let's say someone's got chronic Lyme and other things causing chronic inflammation. How do you get that under control? What does that treatment look like?
ooh, anything that works. And I know that sounds that's the issue. It's, obviously when it comes to tick-borne disease, everybody thinks of, okay, we're going to, antibiotics or anti-parasite medications. And for some people, that really is the way to go. It does. I mean, there are people who we treat with antibiotics and they get better. Now, I don't see them as often as I did 20 years ago, 25 years ago, because again, I tend to see people now who have failed or have been sick for much longer. I think in the first few years of symptoms, many people will respond to antibiotics. Okay. Now, the downside of the antibiotics is that in some people, they will make a mess of their guts that become another decade of repair work. But this is what's so difficult in medicine is that, but there are also lots of people who you can take antibiotics for 6 months and their guts, wind up being a little of an issue, but not much. And you can get them back to normal in a few months later. See, this is what is so hard in medicine, especially medicine on the internet, okay, is because everything we do, there are some people who it's going to hurt badly.
Yeah.
Okay. And our one of my goals, and I think it's been happening, is if we can have a better sense before we start a therapy who is likely to suffer. Okay. Now, a lot of that is from history because people have already done bad things to you, so we know not to do it again. But but looking at someone's microbiome will give you an idea of how robust it is. If it looks like it's already really depleted, if it already has overgrowth or really imbalance in the bacteria, then yeah, it's probably not a good idea. If they don't have any, lactobacillus or bifidobacter to there at all, that they're probably already in a not a good balanced state, and so antibiotics not a good idea. If they have and the funny thing is, people with mast cell activation, herbs usually aren't a good idea. I mean, which always gets people very upset when they already say, I'm so sensitive, I react to everything. But yeah, but herbs have too many chemicals, too many chemical moieties that your body thinks that are information for your immune system. And right now, when you have mast cell activation, those very sensitive cells that are sensing the environment, mainly your mast cells, they don't do their herbs have the signals that mast cells are really good at picking up, and antibiotics you'll tolerate much better. And it goes, and those are the two major things that people think about when treating. But obviously, there are, well, I can say, I mean, there are some people who use frequency therapies, and there are people who use the SOT therapies. There are just a lot of sometimes just there are some people who really, if you just balance their body, I mean, who are capable of the immune system coming back in control. When I say by balancing their body is if their nervous system is working well and you can heal their guts and do what, like I said, what naturopaths and functional medicine doctors like to do, and we all like to do, which is get the gut working well, get the hormones working well, get good sleep and good sun exposure, and do all the right things. But unfortunately, that's rarely somebody who's been sick for 5 years. That stuff works really well if you've been sick for 6 months or a year, and many times you can just do those things. But when you've been ill for a long time, the compensations that your body has had to the infection make it a uphill battle to just get better by balancing out your gut and your hormones. That ship usually has sailed, though it's still important to do, but it's not going to be enough. And one more thing, one of the things that I've really been working on the last 6 months is going back to where I started in medicine. I started in doing this kind of medicine thinking I was going to support people's nutrition. Okay. And, you know, like, and I remember in the early days, this is like 30 something years ago when I started just doing nutritional medicine. You know, we had people would come in with like shopping bags full of supplements. And like I say, I never met a supplement I didn't like. You know, I mean, like, there's always a reason that this supplement is going to help somebody, but whether 50 of them is going to help anybody, I don't think so. But the point is, but now, only in the last few years, we're getting more tests, tests that look at multiple metabolites, multiple chemicals that your body makes. And we're beginning, through the use of AI, to be able to have a better idea of what nutrients you're really low in. And these are often not fancy nutrients, but trace minerals. Okay. Things that don't, and when those are low, because they go low, because when you've been sick, your body gets a little acidotic because you're not burning, you tend to burn more glucose. And so you kind of wind up urinating out a lot of your trace minerals. Your gut's inflamed, so you don't absorb them well. And so you become actually deficient over time. And even though your vitamin levels look normal, they can't work without the trace mineral cofactors. And our blood tests for the trace minerals aren't very good because they're in the blood. And that's not necessarily what's happening in your tissues. So this is an area that I'm looking into more and more, and I'm excited about, because I'm hoping that if we, by fixing and supplementing and restoring the trace mineral and vitamin and vitamins, that we're going to help normalize the immune response, because your immune cells, when they don't have enough energy, they're stuck in this inflammatory mode. I mean, I'll end this speech with one really important thing for people to remember, is that it takes less energy to stay inflamed than it does to be uninflamed, which it's a hard concept. But think of it this way: relaxation is a high energy state. Anxiety is a low energy state. Okay. And if you wonder about that, just think for a minute. What happens if you don't get a good night's sleep and somebody bothers you? Aren't you a lot more irritated when you're not well rested? If you're well rested, people can like come at you and you can go, oh, do I want to respond this way or that way? But if you're tired, you tend to get kind of irritated response real quick because you don't have energy. When you have energy, you have choices. When you have low energy, you lose choices. And the same thing is happening in your cells. Okay. When your T cells and B cells when their mitochondria are not working well, they are primed for inflammation. They are primed for fighting. Okay. When their mitochondria are working normally, they have choice. They are there to disinflame, to quiet down the situation. Okay. They still can turn back to the irritated, to the inflammatory easily, but they have a choice. If your energy is low and you're depleted, all your cells are ready to just fire off. So that's
so let's
story. I hope it made sense at the end.
No, that's all good. So let's take a question here from someone who's watching. Great guys, I resonate with what he says a lot. I had several concussions, but never seemingly had any lasting head and neck issues or CCI from this. But then after having COVID 3 times, I developed severe CCI symptoms, which have proven persistent ever since. What can I do if I truly was COVID that has changed some ligaments, laxity, or damage? So, so let's talk about that. What's your sense of
Well,
this?
it's that issue of, you know, usually the body is, if the inflammation goes back towards normal, the ligaments will tighten up again. Okay. I mean, it's not like you stretch. I mean, I guess sometimes it can get to the point where it's like you stretched out those shoes. They're never going to, but the body's alive. It's not a dead piece of leather. It can, when the inflammation goes down, it can get better, and restore. And so with COVID, the question is it all better? I mean, is there, and is there residual that, virus? And we're just, the testing is not quite there yet, but we're getting there. I mean, there's, I think just looking at your antibody levels, whether there's, because I mean, they shouldn't, this is a virus that the antibody levels should go away after 3 to 6 months. Are they still high? Are they still high to spike protein as well as the N protein? Maybe you have a residual in your gut there. There's a Professor Shaw from England, or the United Kingdom, I guess. He has a new test that I'm just beginning to explore. So but it's something that's called the atom marker test. And it's a way of looking at if you have persistent elevated antibodies to multiple COVID species, or species is probably not the right word, but multiple types of COVID that we've all been exposed to. And there are therapies that have been suggested. So it's a question of just looking to see what's keeping the inflammation persisting, because something, maybe the COVID's all gone and it unmasked a chronic EBV virus. It's very, very common, with COVID, or a tick-borne disease. So it's looking for what could still be there that's keeping your immune system upregulated. And that is the name of the game, I think, is doing our best to figure that out. And our tests are still not great. So that's that's the problem. It's not like you can get the test. Oh, the test was negative and I'm done. No, if you have to talk to a doctor who's got some experience and see, well, maybe even if the test is negative, maybe we should retest a different way, because there's a lot of different tests for all these things. Someday we may, and it's coming, medicine is growing and changing fast. Hopefully in 2 years from now, we'll have many more definitive tests instead of maybe tests.
Gotcha. HPV included in any of this?
Yeah. I mean, again, for most people, the papilloma virus is not a cause of as much systemic inflammation, but I think you'd have to check and get an idea. To be honest, the only reason I think of HPV is because of the few people who've had catastrophic responses to the Gardasil, the HPV vaccine, which again is another aside. It would be nice if we had the resources to test people to know whether they're folks who have a high likelihood of having these terrible responses to things like vaccines, which lots of other people do fine with. And we'd have maybe a more rational discussion someday about this whole vaccine issue, because I said both sides are right, which makes for a very difficult situation, because both sides think the other side is total idiots. And until they can both realize that they both have good points, but nobody's listening to each other.
How about this person's asking about vitamin D and all of this? You talked about getting good sunlight. Go further down that road.
Yeah, I mean, vitamin D and vitamin A are both really important at letting your immune system act normally or act effectively. And that means both, be there to kill things, but also, just as importantly, turn itself off. Because really, the reason people stay ill is usually not only a failure to get rid of the bug, but it's a failure to stop fighting with the bug. Okay. because, like I said, we co-evolved with a lot of these guys. So, you know, EBV, most of us, once we've had mono, it's not leaving. We're going to have a few percent of our B cells are forever infected with it. But guess what? It doesn't matter. And it might even be helpful for some people. I should say it doesn't matter, because maybe in some people it probably does. But in the vast majority of us, having 5 or 10% of our B cells infected, it might actually help us not get sick for other viruses. That's another long story I won't go into. But anyway, so vitamin D levels are really, really important. And again, there are some people who just, you know, don't respond. Most people respond fairly well to sunlight if they get it, but a lot depends on your skin color. And if you have very dark skin and are living in our northern latitudes, you probably need some help to keep your vitamin D levels up, because your body was designed to do well, you know, in somewhere between, like around, you know, in a much sunnier place, and not just sunlight, like with this much more direct sunlight. So it is important. I getting your vitamin, for most people, getting your vitamin D 60 to 80 is probably a very good idea.
Here's another interesting one. Basically, a patient that started Wegovy, now their CCI symptoms are much better. This kind of gets to what we were talking about, right? This chronic inflammation driving symptoms. And, you know, obviously this patient probably was on the edge of type 2 diabetes or hyperinsulinism. And then,
or, you know, I think they just saw a very smart, just a doctor who's paying attention, because this is, what's her name? Dr. Tanya Dempsey, who I really love and respect. And she, I mean, well, a lot of us noticed this, but she really, she and I think Dr. Afrin with her and a few others have really gone out on the limb and written about this, about how using low dose, really micro dosing, you know, instead of 2 milligrams, you know, 0.02, it's, you know, a whole lot less. And it seems to have some significant effects on inflammation. And again, I always love when things prove my point, is that this is exactly it. You lower the inflammation and the tissues improve. I mean, this is impressive, but we're seeing this a lot, and a lot of people in the MCAS community have been are beginning to use this low dose of the GLP-1s with really good effect. And you know, a lot to learn from this. I mean, because I haven't done a deep dive on the physiology of exactly what it's doing beside this magic. Oh, inflammation is going down.
Yeah, no, I mean, that's a good one. Here's another one. Can Lyme disease cause inflammatory arthritis, which can in turn affect vertebral joints and disc? Is the gut where you treat first?
Yeah, well, the answer is yes. That's what Lyme disease is known for. That's what was the hardest part, is convincing doctors that if you didn't have a swollen knee, you didn't have Lyme disease, you know, because that's how, I mean, when I started, that was the only way you thought about Lyme. If the kids would come in with a swollen knee and, oh, maybe it's Lyme. But yes, it does. And it definitely can affect the vertebral joints. We see a lot of spinal pain with Lyme disease. And how much is happening at the macro level. And again, when you come down to things like the spine, it doesn't take much inflammation to cause a lot of noise, okay? Because they're small spaces. This is Dr. Centeno's, world, tiny spaces, you know? Yeah. A little bit of swelling, a lot of noise, because it's the chemical environment. It happens on the physical level of just pressure, but the changes in the micro doses of inflammatory noise creates a lot of pain and a lot of discomfort. So yes.
Blessed beyond. My understanding, I thought ligaments can't be healed on their own. So what Dr. Gordon is saying is that there's a potential ligaments can heal on their own if laxity was caused by infection or more, it seems more like the response to the infection, right?
Yeah. I think it's the inflammation. I'm sure there are ligaments that are definitely hurt. But everything in the body can heal. The question is how much, like you can, you can regrow pieces of your liver. If you're young, you can regrow pieces of almost anything. But as we get older, they can get slower and less for sure. But if you're in your, teenage years, 10, 20s, maybe even 30s, you can probably get a lot, once the inflammation goes, God knows how good you can do. I think as we get older, you don't do so well. then you need more help.
Another one, diagnosed with Lyme bugs 5 years ago, 6-month antibiotics, herbal tinctures, 2+ years. All Lyme symptoms improved except for connective tissue. I have laxity of connective tissue all over the body. What are your thoughts here? Maybe genetic hypermobility is a component, or?
Yeah, I mean, well, there's probably, definitely a genetic component, because I don't think most people who don't have any tendency to hypermobility to begin with rarely develop it. At least I haven't seen it. Almost, one of the things we noticed early on, was that my 60-year-old patients could touch their toes when I was doing regular medicine. My 40-year-old patients couldn't get past their knees. It's Americans are fairly stiff group because we don't do anything. But so the hypermobility is generally, tendency is genetic. But anyway, the point here is it might, this is where some peptides and things and exosomes can help. But I think it's looking a little deeper, looking to see if there are still some viral component or some persistent inflammation in the body, looking at cytokine levels. And again, these are not great tests, but just looking under the hood and poking around and seeing, is there persistent inflammation left? If everything is looking great, then I think it's time to look for more regenerative medicine things to tighten up. And that's where, even though the FDA is not happy with peptides, that is where the systemic peptides can really help some people quite a bit. I wish they would be more reasonable.
Christine, what are some high impact action steps to figure out what might be driving inflammation?
Well, like I said, I'm still waiting for the perfect test, but people talk about SED rates and CRPs, but I have found them to be fairly useless. For some reason, that seems to, those are markers of inflammation for sure, but most of our patients, it's not happening at those levels, and I don't quite know why. Cytokine panels, again, not great because they're often not cheap, and they vary a lot because, cytokines, their levels will change from moment to moment, to be fair. But I think there's just, but again, they're reasonable to do. Get a few cytokine panels, look if there's significant elevations, especially of, IL-6, IL-8, TNF alpha, or just the fact that you'll see sometimes very high IL-10, and that gives you an idea that maybe you should work to resetting your immune system if the only thing that's up is the IL-10, and looking, or maybe there's a hidden parasite. So I haven't answered your question easily. All I can say is that this is where you need the help of a good doctor. And these days, to be fair, a good AI is going to help you a lot. Just make sure that you talk to a good doctor about what the AI tells you. Okay. The AI is really, I think every patient should be using it. Just remember, you don't really know what the words mean. And sometimes the AI is off. And even when it's right, I just don't want to be arrogant again, but you don't know what the words mean. Okay. Because don't do anything rash based on ChatGPT. But on the other hand, do bring it to your doctor, because it's amazing how many things that we can only think about, a few things, and AI's got us.
Yep. Let's see here. So where would one go get tested for possible issues linked to lingering COVID infection inflammation. You mentioned a Dr. Shaw in the UK who offers testing. Can you provide more details? I'm UK based.
Ah, um, well, let's say in the UK, I don't know many. I know one doctor. What's his Ben? Oh, I have to remember. But doctor, if you just look for Professor Shaw, the Atta marker, I think it's ATTAMARKE marker. Yeah, ATTA marker. That's a place to start, and I think they can refer you to other doctors who are interested in COVID and long COVID in the UK. And there's not a lot of them, but there's a bunch, and it's interesting. And then because they have a centralized health registry in the United Kingdom, they're actually doing some interesting work. So I think that's a good place to start.
How much does elastase from mast cells or parasites contribute to connective tissue damage and hypermobility? Are there supplements that may help mitigate elastase while treating root causes?
Good question. They do. Elastase, yes, from mast cells definitely are part of the problem. I don't know how much the parasite contribution would be, because I would imagine that's pretty. The thing about most of these chemicals, almost all of them work very locally. Okay. It's not that, because these are usually destroyed very fast. The turnover in the body for chemical information is usually, especially chemical information that can hurt you, is usually very small areas and for very short periods of time. Okay. So it's more probably the mast cells that are your issue. And how to treat elastase, I don't know off the top of my head. What I always tell people now is that, because I'm very old, and my short term and my memory, I know I'm very thankful that I lived long enough to see AI, because it's my friend, because I know lots of things, but the details go away. So I'm just happy it's there. So you can do the same, and then talk to your doctor. Okay, but I really encourage people that the world has opened up. I mean, I've learned ever since the internet. Well, actually, before the internet, my patients were good. They were always looking things up in the library. But ever since the internet, I have learned probably at least 30 to 50% of new information from my patients who are busy looking stuff up.
Yeah, I agree with that. Dr. Gordon, what do you think of organic acid tests for mitochondrial function?
They're a hint. They're a good hint. Okay. Again, it's all in the interpretation, and this comes back again. Years ago, I myself I used the organic acid test on a very basis, but I don't know, about 10 years ago, I started working with a fellow, Michael McAvoy, who actually has, I think, a course online if you really want to get good at interpreting the organic acid test, because there's a lot of information there. Again, it's all contextual. The organic acid test can vary. So don't run with one test. But if the numbers are off by quite a bit, they are usually significant. Okay, it's just what I'm saying. If they're off just a little bit, if it's a little far from normal, and because they're urine, and they're not that well calibrated, because they're trying to, just believe me, but they're good tests if you get somebody who knows what they're doing to help interpret it with you, and it can give you a pretty good idea of if your mitochondria are in trouble.
Gotcha. Can I get a cytokine panel testing through a naturopath?
Yes. Yeah. If they can order blood work, sure. LabCorp, Quest have panels that I'm not. I prefer InfectoLab has a nice panel that's not too expensive, but it's not covered by insurance, so that's a thought. A lot of people were getting the panels from Radiance and the Bruce Patterson's COVID tests. Again, remember, these things can vary, but if they're significantly off, keep looking. So
Noreen, is endothelial dysfunction secondary to severe eclampsia a contributing factor? That's an interesting one.
Very interesting. I haven't thought a lot about eclampsia in a long time, but basically, dysfunction, I think in my mind, is really part of the eclampsia. I mean, like, God, I haven't thought about eclampsia in a very long time, but basically it is vascular. In my mind, eclampsia is a vascular problem. I mean, that's what it is. So, and whatever allowed the development of the eclampsia. And again, that's where some of the trace minerals, magnesium and things of that sort, probably play a significant role or a role. I'm sorry, I really can't give you a detailed answer because I said I haven't. It's been probably it's been a long. It's been 40 something years since I delivered a baby.
That's right. As a USA resident, where's the best place to get tested for lingering infection and inflammation? How would they go about doing that?
God, I mean, the best place there is. I mean, that's the problem. Is that it's a work in progress because nobody's. We're all struggling. I think. And if you look around at any of the doctors that are working in the field of long COVID and and chronic tick-borne diseases, you're going to find and MEC, the doctors who treat MECFS, who understand that a significant percentage of people with MECFS have underlying tick-borne disease. Not all of them, but a lot of them. And this was a recent study that confirmed in a cohort in a group in I forgot. I think it was in England, that just showed that there were positive, that a lot of people with MECFS have, and which is difficult because patients fall in love with their diagnoses. And I just urge all of you to remember that, yes, you are ill, but you could have gotten there for lots of different causes. And just because you start off with a diagnosis of tick-borne disease doesn't mean you can't really have more chronic fatigue, and vice versa. They're not mutually exclusive. They often come together. So at the end of the day, you just got to find a good doctor because I can tell you that medical centers are pretty useless at those kind of things, unfortunately.
Can we work through these infections while going through a PICL? Would that serve the best net benefit?
Oh, that's a good question.
Yeah, most of our patients have worked, well, they've tried to work through them. I think, as Dr. Gordon has said, his practice is now dominated by patients who have failed the low-hanging fruit stuff, if you will, when it comes to functional medicine. And so many of our patients are in that boat. But what are your thoughts, Eric, about this one?
Well, it's ideally you would treat the infection first, but if somebody there's a patient but if somebody is in the position where when the CCI is severe, anything you do that increases inflammation will give them severe dysautonomias, like they just can't, they just start throwing up, or that they can't function. They get derealization. I mean, their brains go, their whole system goes. Then no, you gotta deal with the neck first. I mean, that's the thing. We would love to treat the infections first, hoping that they're not going to need any fancy interventions. But the reality is there's lots of people that until you stabilize the neck, the immune system is going to overreact to everything you do. So people are going to think that they're sensitive to every medicine given to them. And it's not true. Once they get the neck stabilized, then you can then treat them. I think mast cell stabilization is something always to work on first with people, but treating infections often has to wait until the neck has been stabilized. Unfortunately, it just depends on the patient.
And so, this is a good one to end with here. If systemic inflammation can affect CCI, can CCI cause systemic inflammation, which is what I think you just said, right? At the end of the day, there are times when you're beating up your vagus nerve in your neck, and that's impacting the inflammatory environment and or other things, or the autonomic components are causing issues. So there are times when you got to intervene on the neck side.
Yeah, it's a circle, because we always talk about the vagus, and it's not just the vagus, but the vagus, that whole part of the vagus. What is it? The alpha, alpha 7 acetylcholine receptor. Anyway, it's this cool little receptor in near your spleen, but in all your organs, that the vagus nerve sends anti-inflammatory signals to the resident macrophages in those organs. And if the vagus isn't quieting down, then you've got these little white blood type of these macrophages, these site white blood cells that are really designed to fight in a very irritable mode.
Well, M1 and M2 polarization. So yeah.
So yes, it is a circle, and this is where you need to see Chris and patients and doctors like us, and try to work out what's right. The issue in this field is that we're dealing with individuals. That's the thing, is that when you go to Stanford or Mayo or Harvard, wherever you're, they're doing population medicine. They're doing things that are going to work for, whatever 80%, 90% of the people they see. By the time you're seeing people like us, you've fallen off that bus. You're not there. It's all about you. Okay, you don't want to be an exquisitely individual when it comes to your health. Unfortunately, if you're listening to this, you are. Okay. And that's the problem.
We got thank yous here. We got thank yous there.
Okay. And it was fun. Thank you. Yeah. Thank you very much, Chris, for inviting me. I mean, it's always interesting to think about these things from new perspectives.
Well, thank you so much, Eric, for joining us tonight, especially after your clinical day. I want to thank everyone for joining us, for all the great questions. As I always say, there are no bad questions. Questions help to prompt discussion. Questions help other people learn about maybe things they hadn't thought about before. So thank you for participating tonight. We'll be back at the 4:00 time Thursday next week. And Eric, thanks so much, and I'll let you go from here.
Thank you. Pleasure. Okay. Be well. Bye-bye.